Hello friends, I'm Jasbin Johnson and I welcome you to our YouTube channel Soma's Evolution Classes. In this video, I'll explain the myocardial infarctions, biochemical aspects and the markers for diagnosis. Myocardial infarction, which is also called as heart attack, it usually happens when one or more areas of the heart muscle does not get enough oxygen or blood flow to the heart muscles is blocked, which later causes myocardial cell death, necrosis. It could be cell silent also, an unfortunate event that causes hemodynamic decline and premature death. There are two different classifications of it. Modifiable risk factors, which are under the abnormal lipid profile, blood apolipoproteins, smoking, diabetic mellitus, improper health habits, hypertension, lack of physical activity, which develops to abdominal obesity, increased hormonal changes, which develops to abdominal obesity, psychological factors, which are depression, loss, global stress, life events including the martial and the family conflicts. Unmodifiable risk, that is factors which comes under the age, that is heart attack, which can be the women's mostly affected from 55 to 45 accordingly. Then we have is gender, the strong family history. Here it shows the two pictures. First picture represents or explains about how the heart develops and deposits and causes myocardial infarction. The second picture defines the different type of reasons or the factors by which myocardial infections can occur. Here in this picture, myocardial metabolism defects in the heart failure. Under control condition, cardiomyocyte mostly utilizes free fatty acid as primary substrate. However, in the presence of the overload and the heart failure, cardiomyocytes switch the substrate reference to glucose. There are different prognosis test panel which helps in identifying the conditions before. The following are the test panels. First is the blood sugar fasting. Normal range is 70 mg to 100 mg per deciliter. Normal hormonal control of the blood glucose concentration disturbed by the stress. Second is the blood sugar, which has a normal range of 100 to 140, which prevents the cardiovascular diseases. Second is the serum nitrogen. Then the third, which is because of the decreased glomerular filtration rate, increased load of urine excretions and increase of the tubular reabsorption of urea. Fourth is the serum creatinine. We have normal ranges here. This is because mostly in the women's we have less mass comparing to men, whereas in creatine levels in the muscles plus in size differentiates. Then we have electrolytes, we have sodium and potassium more in number. The prognosis usually differentiates and causes hyponatremia and hypokalemia. This table represents the evolution test panel. It includes the serum total cholesterol. It has normal values are given. The serum HDL, which is called as high density lipoprotein. Then we have is the cholesterol and the triglyceride. High triglyceride attributes to hardening of the arteries and which causes the increase in the risk of stroke, heart attack and heart diseases. Extremely high triglyceride can cause acute inflammation of the pancreas, which is pancreatitis. Serum VLDL and HDL, the values are given above. Then we have is the different biomarkers in diagnosis of MI condition, that is myocardial infarction. That is myoglobin, troponin I, T, CKMB, we have LDH, SDOT, dopamine, catecholamines, heart type fatty acid binding protein, glycogen phosphorylase enzyme BB. Then we have serum hydroxybutyrate dehydrogenase, which is also called as HBD. About myoglobin. Globin is a protein that is found in the striated muscles, which includes skeletal muscles, the bones and the tendons and the heart muscles. Main function is to supply the oxygen to the cell in your muscles. Myoglobin gets accumulated in the bloodstream after muscle damage. The normal ranges are 5 to 70 microgram per deciliter in blood, which is available in high in urine due to the acute kidney failure. About troponin and its isoenzyme. It is a type of protein found in the muscles of the heart, smooth muscles, and do not contain troponin. There are two different forms of troponin. Troponin I, it is called as actinomycin ATPase inhibitory elements, inhibits the interactions of myosin and actin. Whereas in case of troponin T, we have tropomyosin binding element. The normal ranges are given below. Then we have is troponin C, that is calcium binding, that helps in the initiation and contraction. Normal range of troponin level usually increases the sharpening within 3 to 12 hours after heart attack and peak about 24 hours after heart attack. It also remains high for several days. This picture represents the parts of troponin and the presence of all the three isoenzyme forms, and it activates the ATP hydrolysis to form ADP and phosphate. About creatine kinase, an enzyme found in the skeletal muscles and heart and the lesser amount in brain. The beginning within the 6 hours and peaking average of 24 hours return to the normal within 2 to 3 days. The peak totally depends on the size of the infarct. The normal range is 5 to 25 international unit. About lactate dehydrogenase, an enzyme which is present inside the body. The type which is get activated is when less amount of oxygen is present in body. There are the 5 isoenzymes of LDH from 1 to 5 and subunit of M and H. M stands for muscles and H stands for heart. The next parameter is dopamine. Dopamine frequently is used to improve cardiac performance after acute myocardial ischemia. The normal ranges are 0.5 to 4 microgram per kg per minute, and it is usually used for treatment of congested heart failures and entropic effects of direct beta-1 adenoreceptor stimulation. Normal range is 65 to 400 microgram per 24 hours. Then we have is it during the myocardial infarction, malignant arrhythmia and acceleration of cell damage may be induced by hypertech stimulation of heart. Low concentration of catecholamine stimulates the heart by promoting calcium movement, whereas excessive amount of catecholamines produced in the cardiac dysfunction by inducing intracellular calcium overload in cardiomyocytes. Then we have is the glycogen phosphorylase isoenzyme BB. It is a key rate element that is necessary for breakdown of glycogen. During this the ischemia, the GPB is activated and cause increase in glycogen dehydration. The tubular systems in the peak value within the 4 hours after the onset of chest pain. The early release of GBP in the blood is a common result of combination of escalations of glycogenesis and the permeability in the cell membrane, which usually causes necrosis or ischemia. Heart-type fatty acid binding protein serves as a transport system. It activates the PARs and therefore plays an important role in lipid metabolism and energy hemostasis. The normal range is 8 to 16 nanogram per milliliter. Now we have is a serum hydroxylate butyrate dehydrogenase. It is an enzyme similar to lactate which is found in the brain, heart, muscles, kidneys and red blood cells. The normal range is 68 to 135 units per liter. The numerous biomarkers for myocardial infarction diagnosis were as follows. I greatly appreciate your attention. If you enjoyed the video, please do like and subscribe our channel Suma's Evolution Classes. For more interesting videos, stay tuned to our channel. Thank you.